Can you change scoliosis or the curve in your spine with exercise? Hi, I'm Dr. George Morris. I'm an evidence-based chiropractor, and I'm here to teach you how to feel and perform your best. As a chiropractor, I get asked all the time, if you have scoliosis, can you change that curve? Can you adjust the spine into being straight? Can you exercise it into being straight? What about braces? What about surgery? So this is kind of a tricky topic because the research, in my opinion, is lacking across multiple fronts. Obviously, surgery is the most extreme version of this, and yeah, with surgery, you're gonna be able to correct that curve. Usually they use titanium rods to actually straighten the spine. The problem with that is that now you have rods in your back and you lack that range of motion. And so while your spine might be straight, now you're lacking the normal healthy range of motion that your spine used to have. So that is a solution for certain people. Sometimes they have to do it, they don't have an option. And if you need that surgery, it's a really good idea to get it. But can we change the curve without actually having to get surgery? So the evidence here is kind of mixed. There are case reports showing that exercise and even manipulation of the spine can reverse a scoliotic curve. The problem is that we don't have great evidence behind this. We don't have large meta-analyses, we don't have large studies with multiple people, but I do see this in practice daily. I've helped people and we can actually measure the change in the curve with the x-ray. Would I advertise that I can straighten out your scoliosis? No, because unfortunately, we're actually still figuring out what causes the majority of scoliosis. We don't actually know. They're idiopathic, right? Without knowing the exact cause, it's kind of hard to change that, or at least guarantee that you're gonna be able to change that. Some exercises that people find very helpful is side bending to the opposite side of the curve. So bending into the convex side, right? So you're gonna straighten it out over time. A lot of people find that weight-bearing exercises like back squats and deadlifts can often help, but it's not a guarantee. Exercise therapy has been shown to improve discomfort and range of motion that's associated with scoliosis. So if you suspect that your back pain is possibly coming from your scoliosis, then it's probably a good idea to get moving and to exercise. And so if you really need help, you can always go to an expert. A physical therapist or a good chiropractor should know how to handle that, but it's usually pretty typically safe for most people to start experimenting with exercise as long as it doesn't increase your pain. If you have scoliosis and you're wondering if we can actually change that curve, the answer is we don't know yet. I do think that it's a low risk thing to try to do on your own as an experiment. So if you've had any success with this, please let me know what you think in the comments.